Thank you.
Thank you. Thank you so much. And now it's time for our friend Mary. Ahí está. Ahí estamos con Mary. Our friend and colleague Mary Angeline has over 16 years of service in teaching and professional practice as a social worker and social work educator. She has worked in each of these capacities in College of Repute, the latest being Madras School of Social Work, Chennai, India. Her research interests include women, tribal children, and development studies through action-based research in Tamil Nadu. Her area of primary research is with the tribal women in rural tribes. She has drafted many projects for the empowerment of these women. She has, to her credit, research publications over 10 in national and 10 in international journals and conference proceedings. She also has been a course writer for social work and development management course at the national and state level universities. She is in the peer review board of 5 international journals. We are very happy, and it is an honor to have Mary Angeline as one of our speakers and our Congress. Hello, Mary.
Hello, Carolina. Thank you so much for those kind words. Thank you.
Thank you.
I think we are behind the timing. I should have started my talk by 8. It's late here this evening in Chennai. And very good morning to all the people there who have joined in the different timelines. And very good evening to my friends here in India. I'm Dr. Mary Angeline. I'm the principal of Nazareth College of Arts and Science. I'm basically a social worker as well as a social work educator and an administrator. I'm currently the principal of Nazareth College of Arts and Science. And I'm really happy and thankful to Carolina for giving me this opportunity. And I appreciate the enormous effort that she has taken to bring 40 plus speakers online for the conference. It's amazing how you have done it, Carolina. And I'm really happy to be here. And this topic, this conference on the future of social well-being, mental health, human talent of organization in the digital age. I think it is a very apt theme that you have conceived, which explores how technology can reshape the individuals and how they thrive socially and emotionally, as well as how organizations manage their talent. So I would now jump into my presentation. Just need a confirmation if you are able to. Is it visible, Carolina?
Yes, it's okay.
Yes, thank you so much for the confirmation. And before I could go on to the topic, I would like to introduce my institution where I come from. Nazareth College of Arts and Science is situated at Avadi, Chennai. We are a rural-based college. And we were established conventional courses. We are affiliated to the University of Madras, and this college aims to foster academic excellence and holistic development. We offer 9 undergraduate courses and 4 postgraduate courses, of which we have 1 undergraduate course, Bachelor of Social Work, and 1 postgraduate course, Master of Social Work, with 3 specializations. We also have 8 centers of excellence, 9 associations, and many more cells and clubs that support our students in the institution. Our distinctiveness is in community service and social responsibility. And this is integral to the college ethos. And the students are encouraged to engage in various outreach programs. The motto of our college is truth, joy, and peace. that represents the institution always strives to instill in its students and the community. The Nazareth College is known for its many best practices towards all the projects that is done for the community and its distinctiveness in sports. And since we are a rural-based college, we 60% of our students come from below poverty line. They are first-generation learners, and digital transformation was very difficult for us. In particular, when during COVID-19, it was an eye opener for our students and faculty. It helped us to sort of move from a traditional teaching to online teaching post pandemic. And but we had no other option to go into transformation of our education system. We had to give more importance to online learning through Google Classrooms, and that's how we also transformed into the digital world. And with no other go, the social work students also had to be part of it. Social work education is not only educating the students in class with theory, but it is more of a fieldwork based education. But transition to the digital world was very difficult for us, but we did really very well. So, going on to my topic, digital transformation in social work. I start my presentation. This is how I go about. Since I always go on extempore, this time I thought because we have a lot of information to share on digital transformation, a few case studies and success stories, I thought let's go into a very formal format of how overview of what digital transformation is, the need for digital transformation in social work, and why digital transformation, the challenges it that we face, the case studies or the success stories, the benefits of digital transformation, and finally a call to action. Moving on to the overview of digital transformation. As I previously said, COVID 19 had become a real challenge for the society all over the world. And digitalization was inevitable in all professions, and especially in social work. So, first, let us understand what digital transformation is. It is a continuous process of adopting digital technologies into all areas, and it is a strategic process to improve the current state of operation. You increase efficiency, you enhance the experience through the use of technological advancement. Digital initiatives, as you know, they require commitment from the leadership, change agents, the team members, but most importantly, it needs a fundamental change in the organizational culture. This is very important even for a social work profession. Rather than merely using more technologies to perform, we need to think how these digital advancements can improve a value delivery of our services to the individuals, groups, and communities. This shift to digitalization is not only merely adopting new technologies, but the change in how the services are delivered and how practitioners can engage with those they serve. That is, again, the individuals, groups, and communities. What are the key aspects of digital transformation? There are four key aspects that we can think of. One is technology integration. How we can integrate our technology into our service delivery when we work with individuals, groups, and communities. How the process of optimization, how social workers can reduce the manual effort and enable the real data exchange and monitoring when you work for service. How enhanced user experience and how you focus on engaging the digital interactions, whether with clients or beneficiaries. A cultural change, encouraging a mindset that can adopt to innovation and continuous learning. These are the four aspects that goes on for digital transformation. What is the need for digital transformation in social work? Because of the challenges that we face in traditional social work models. And COVID 19, I said, it was an eye opener for all of us. So, what are the challenges that traditional social work models faced accessibility barriers in remote areas. Our institution is located in a rural area, and we work with the villages in a rural area, and accessing or moving to the rural area to work for the communities was a greater problem. The limited resources and the gaps that we have in service delivery because of this traditional social work models. What are the opportunities through technology? Opportunities that opened up was mobile-based solutions and digital platforms. Mobile-based solutions, we have WhatsApp, and through which we were able to communicate our fieldwork reports. We were able to communicate with the fieldwork agencies. And digital platforms helped us a lot. Like we used MyOS Connect and Map SDGs as a digital platform for education, learning, and placement, and using the real-time data for decision making and monitoring. Moving on to why digital transformation in social work. We need to expand our access to social services. These are a few examples. If you see the 7 points, they have the examples of what digital media is being used to access the social service. For example, expanding the access to social service, telemanus. I will go in detail in the success stories of all these platforms. Enhancing efficiency and timeliness, Captera, data-driven interventions for informed decision making, IHAT, promoting inclusion and digital empowerment, that is through eShram, strengthening community engagement through Gramavani, facilitating a collaborative network, that is through Salesforce for nonprofits, and capacity building for social workers through MAP SDG. See, this is a representation of all the digital platforms. All these digital platforms have been working for the community, both at the individual basis, the group, and for the students too. And the people behind this who have developed this digital platforms are the social workers. As I said previously, what are the challenges and limitations of digital transformation with the digital limited internet access in remote regions? Yes, we are talking about connecting to the community from Nazareth College of Arts and Science, but I should know whether the client or the communities who are in the villages that we have adopted have this access to take or to connect with us for the various services that they need. Another important challenge or limitation can be the privacy and data security issues. As you know, principle of confidentiality is very important in social work, and how this data that we get from the community or the individuals is protected. Next is the capacity building. How do we train the social workers who have always been on the traditional mode of doing casework, group work, writing it down and talking to people? How will they use technology effectively? So let's see a few of our success stories. The first success story is Sati. This is the support for advocacy and training to health initiatives. This is an amazing uh, digital platform which can be expanded to support advocacy training for health initiative, which provides emotional and mental health support for women in distress. This offers a very safe space for women. They can come and discuss the issues. They can receive professional guidance anonymously. That is very important. Receiving a guidance anonymously. Sati works on health right issues through partnership through civil society organizations. And what is the reach and effectiveness of Sati? Thousands of women have accessed the mental health resources through this app. They have increased the awareness about mental health issues among rural women. Let's go to the next success story. These are some of the activities done by Sati. You see a group of women who are seated here for understanding the level of awareness. Going on to the next platform, which is very dear to me. This is called the Digital Empowerment Foundation. This is a Delhi-based non-profit organization that is working towards empowering people who to gain access to better healthcare, education, skills, and livelihood opportunities through digital literacy and digital tools. So the people behind this project or behind Digital Empowerment Foundation are a group of social workers, IT professionals, and people who are like-minded who have joined this. This organization focuses to make technology easily accessible to the masses, to empower women, youth, persons with disabilities, and the elderly through providing digital literacy, media literacy, and digital upskilling. What is the success metrics of this foundation? Thousands of women have been trained, leading to increased participation in government welfare programs. There is improved income levels. The income levels of the women have improved through these digital platforms for entrepreneurship. The third case study or success story is of Arman. Arman is a free mobile voice call service that sends timed and targeted preventive care information on a weekly or bi-weekly basis directly to the phones of the enrolled women through pregnancy and infancy in the chosen language and time slot. Again, what is the success metrics of this? Arman has reached 200 has reached 2 lakhs beneficiaries across urban slums, thereby improving the healthcare outcomes through culturally relevant health information. They partner with NGOs, hospitals, and municipalities. This also aims to reach close to 5 million beneficiaries in the coming years. What is the next? The fourth success story, or a case study is Gramavani. Gramavani is a voice-based platform for communities to report their issues, exchange ideas, and engage with local governance. It is a social technology platform that leverages on the interactive voice response IVR, and through this, the users share the local news, health tips, information on governance, agriculture, and social issues, empowering the marginalized group. The success metrics of Gramavani. Over 2.5 million users are using primarily from the underserved rural areas uses, and there are thousands of local stories and updates shared through the IVR platform and grievances also. It has helped in resolving civic issues and improving the healthcare delivery. The next one is for the education, MAP SDGs. MAP SDGs is a platform uh, that empowers the organizations to make a real difference with innovations. It helps organizations like academic institutions, NGOs, and corporates and CSR initiatives to report compliance and measure the contribution towards global sustainability. It's a versatile platform designed for diverse sectors. What is the success? Capacity building programs for social workers and social educators are currently given through MAP SDGs. I'm really happy to say this is one of our patent of Nazareth College of Arts and Science, and capacity building program for social workers and social educators are through this platform. It goes on with curriculum mapping, how the projects, there is a impact, how the impact is measured. And through the SDG Transformation Center, we sort of do a lot of research projects. What about the success metrics? The institutions can monitor their projects and initiatives. Then automated reports are aligned with the global reporting standards. And it also fosters the teamwork within the organizations and also facilitates external partnership. It focuses on areas that institutions can track their progress effectively and create meaningful, scalable impact, aligning them with the SDGs. The next success story is Comcare. Comcare is widely used across India. This is an open source mobile platform which helps social and community workers monitor the health interventions, conduct surveys, and collect real time data. It provides automated reminders for follow ups and making it very valuable for both the social work and healthcare sectors. The success metrics. It has facilitated critical health interventions such as child health campaigns, maternal care, and early childhood development, and impacted over 77,000 clients across multiple countries, including India, Nigeria, and Kenya. It has empowered social workers and given them greater autonomy by self-signing for services and completing their interventions independently. The next success story is My Hero. My Hero was initially developed for health workers. This is a platform that can be adapted for social work, and the success metrics are connected with 17,000 health workers. Have been using it and coordinating among health systems. Going on to the benefits of digital transformation, as I said, it is enhanced digital transformation has enhanced the accessibility of the services to the marginalized communities. It has increased efficiency to the cellular service, reducing the response times and reducing the wastage. It has promoted inclusion. Digital platforms can engage users who were previously underserved, ensuring the voices are heard. And scalability. We are able to use this at a greater extent. And for all the social work institution, all the social works in India can use this platform for their service and for learning and for an educational platform to communicate with the community, be community with the individual or in the groups. Going on for the call of action. So invest, I would say, social work institutions should invest in digital infrastructure so that they have a better access to the communities, implement capacity building program for social workers, then foster public-private partnership to innovate solutions because higher education institutions alone cannot work on innovation. They will have to have partnerships. A collaborative approach is always essential if we have to realize the benefits of the digital transformation in social work. So finally, we need to ensure that no one is left behind. So what is the vision for the future? You prioritize and inclusive policies that account for the needs of the most vulnerable people. You leverage on technology to ensure that equitable access to social services are there for all. You continually assess and adapt strategies to meet the evolving needs of the communities, reduce the delays and ensure timely assistance, which is through automation, increase outreach to remote and unserved areas through mobile platforms, help social workers make informed decisions using the analytics and dashboards, allow services to reach more beneficiaries at a reduced operational cost. To conclude, the biggest part of digital transformation is changing the way that we think. Social workers need to change that we think so that we move on from the traditional method to a more digital way of dealing with things. I think this picture is worth 1,000 words. And thank you for your patient listening. This is Dr. Mary Angeline. This is my mail ID and my mobile number with the website of my institution. And I also have included my LinkedIn profile, Facebook, and my CV. Thank you once again for your patient listening.
Thank you so much, Mary. So now questions, friends. Maybe Habib could help us with some comments.
I'm also happy to share that we'll be doing a workshop on MAP SDGs at Habib's conference.
Yeah. Well, Mary is really good work that you are doing with digital transformation and how the social workers need to prepare to integrate in this in the system, because the digital is everywhere. What do you think are the problems in our society with social workers and with digital transformation? Are easy for social workers just integrate to this transformation?
Yes, see, I told you that we come from a rural college and we are situated outside Chennai. And adopting digital transformation was very difficult for us, and still we face a lot of difficulties because students come from a lower economic status, having a mobile phone. If you have to use an app, they need to possess a mobile. And buying a mobile itself is a very big challenge for the student. And if that student is going to do social work, then it becomes difficult for him to adopt. While in cities and I think in the urban areas, the students have tried to include digital transformation. We are training our students also to do the same. Like now, when they're going for field work, we are recording the attendance by the form of doing a geotagging and seeing that they are present in the institution for the fieldwork process. Instead of asking the fieldwork supervisor, "Oh, has my student turned up for the fieldwork?" Uh, so we have slowly moved from the traditional method of marking the attendance into more digitalized process. Now we are into Instagrams because we do a lot of service and we connect with communities. We learn through their experience. We do many projects which we want the others to see and learn from us also. Social workers need to share knowledge. That's how we learn. Each country must be doing a different way. By learning, I think we can do a better job to the community that we work with. So we are using Instagram to make the others follow us and understand the work that we are doing. We are using Google Classroom in an asynchronized mode, although post-COVID, most of the colleges have done with the online teaching and not using the Google Classroom. We have still modified our syllabus so that we have 75% of classrooms and 25% of Google Classrooms, wherein we do the assessment, they do the self-study, we pose the questions, we have the assessments. And so we are taking small baby steps towards digital transformation. And I can assure you in another 2 years, we'll be doing really fine. And one of the innovation I can share with you is MAP SDG, which targets the faculty and the students, wherein they can uh, map their curriculum, the various activities they do for the community and the various activities they do for their cells and associations, and also map the learning and teaching methodology. That's the new innovation of our college, which we are sort of publicizing for other institutions to follow because we are really enjoying working in that platform.
Do you have a special course of digital transformation in the university for the students?
No, we do not have a special course on digital transformation, but we hope to bring it through a Nazareth SDG Transformation Center of Nazareth College of Arts and Science, which we inaugurated last year during an international conference which happened at Chennai Loyola College. And we hope to bring this course, a digital transformation course, specifically targeted for social workers in the coming academic year 2025.
Oh, that's great. That's great. Congratulations. Any question,
Thank you.
Tamara? Or you,
Pardon?
Tamara, you would like to do any question? No? Yeah. And in your country, well, we know that is a special that the people know the other careers also have experts in digital careers. Even they specialize
Our
on.
college has BSc Computer Science and Bachelor's in Computer Application. And our students are very smart. They are developing the apps.
Yeah, yeah,
And
yeah.
recently, we gave a project to one of the BCA department to develop an app for our social workers. And they are doing fine. I think it's small steps, and we should be doing fine another 2 years.
Yeah, but when you are just in the area, no, when they, o sea, other careers are growing up and the social workers are watching, no, their friends, no? So they like to grow up too. So that's why you are, o sea, I don't see so much social workers as you that teach, no, the digital subjects on anything, no, like that. So is the first woman that I met who speak about this subject. And I really congratulate for that and for all the things that you we will continue seeing us out in the future for more for sharing more experience and to know.
Yes, yes.
Yeah.
You should visit SDG Transformation Center. We are doing amazing work there. We have incubation facility. We are working with 5 adopted villages. We are rolling out many field live projects, and we do have a workshop that is scheduled in the month of January 2025, wherein we have 4 to 5 of our MOU partners visiting us for a 10-day live project experience with us. So I would
Wow.
welcome Carolina also to be part of it. We
Thank
hope to see you in the month of January 2025. We will send you the details so that you
you.
can work on it. And
Oh,
Habibur is coming,
oh, that's
and we have
great.
a
That's
team.
great.
Yes, yes, and we have a team from Thailand, 10 social workers who are going to visit us in January.
Okay, we will put in the agenda. Now
Yeah.
we have a question of Idris. A ver, Idris, show up.
Yeah, hello.
Oh,
Hi.
Thank you very much, Mary. It was a very good presentation.
Thank you.
I really appreciate it because I'm a joint master student here in Europe. So we have a subject called digital social work, and we are studying all the approaches and what you mentioned. And your work was really inspiring because it was so much practical, especially the case studies. So I truly, really appreciate it. You have done some great job. So I'm really interested to follow your work and your website, especially to connect with you in this regard. And lately, I joined this conference. I was listening to Professor Habibur Rahman. He is a gem in our social work because he is the one who has a social genius. I call him a social genius because he connect everyone with everyone, and he give us opportunity. And also with the organizer of this conference, I truly appreciate. Although we are from different part of the world, but we are listening to each other. We are learning from each other. It was so much nice to especially listen to Habibur Rahman and Mary, to you. It's been my pleasure to be with you in this conference. Really appreciated this work. Thank you very much.
Thank you, Driz. You're welcome to Chennai, India, and you're also welcome to our SDG Transformation Center. We would definitely love to work with you.
Thank you very much. Thank you very much. Actually, my area of research is school social work. So
Wonderful.
I'm from Pakistan. So I was the pioneer of school social work in Pakistan. I have buried some work in India. They're going well. And Europe, there's somehow. But I would really want to see how Indian school social work is going on and how they are adopting the new tools, and they contextualize the school social work. So I think in the previous this sessions, Habibur Rahman was talking about school social work. I saw something on Facebook, but I was not there. So I will later on I will see the video and watch it so that I know what was there actually. So I hope to see you somewhere there in India to participate and collaborate with you. But great job! You're doing such a great and inspiring work. It's really inspiring.
Thank you.
Thank
Thank
you.
you.
Thank you so much, Idris or Idris. um, well, we appreciate all your work. Again, no, we don't have words to say thank you for being here today and share your experience, share your knowledge with the people who is right now in the room and who is watching us in YouTube, and people who will watch you later, no, because some people are just on other times, but I really appreciate all your work, Mary, again, and sure, we will continue
Thank you.
in contact.
And namaste from India. Thank you. Thank you.
Your final words, Mary, for the audience.
It is a wonderful session today, and I have no words to thank Carolina. And I'm really happy that I spoke on digital transformation because it's the first time I'm speaking. And
Really?
I always tell myself, yes, it's the first time I'm speaking on the topic. And
Wow.
these are a few success stories that I've shared with you. There are many success stories because paucity of time, I just chose which is the best, and I have shared with you. And my talk now has inspired me to learn more on the digitalization, not only in India, but how this transformation has happened throughout the world. Maybe I would love to write a book on it. Let's see what's the plan is there for the
You
future.
could. A lot of energy for books.
Anybody wants to join me can join me as a co-author for this book. Thank you.
Yeah.
Thank you once again, Carolina. Bye-bye.
Thank you, Mary, for being here today.